Thinking about changing your tirzepatide injection day? Here's what you need to know and why talking to your healthcare provider first is so important. If you're using tirzepatide, whether that's Mounjaro for type 2 diabetes or Zepbound for weight management, you might be wondering about flexibility with your weekly injection schedule. Maybe you're traveling or a different day would just work better for your routine. It's a common question, and the answer isn't as simple as just moving your dose around. First things first, this video is for general information only and isn't medical advice. Do not change your medication schedule without guidance from your prescribing clinician or pharmacist. They know your complete medical history and can give you personalized recommendations that are safe for your specific situation. So let's talk about what tirzepatide is and why timing matters. This is a once-weekly injection that works as a dual hormone receptor agonist. That means it affects two different pathways in your body to help control blood sugar and reduce appetite. It enhances insulin secretion when you eat, affects other hormones that regulate blood sugar, slows down digestion, and helps reduce appetite. All of these effects work together, and maintaining consistent dosing helps keep everything working optimally. The FDA-approved prescribing information specifies that tirzepatide should be taken once weekly on the same day each week. You can take it at any time of day with or without food, but consistency is key. This regular schedule helps maintain stable medication levels in your body and supports the best outcomes for blood sugar control or weight management. Now, the prescribing information does mention some flexibility in timing, but here's the critical part. The specifics of how and when you can adjust your schedule should come from your healthcare provider, not from a YouTube video. The FDA label and medication guide contain detailed instructions, but interpreting those for your personal situation requires professional guidance. Why is this so important? Well, changing your dosing schedule can affect how the medication works in your body. Taking doses closer together than recommended could temporarily increase side effects. The most common ones are gastrointestinal, things like nausea, decreased appetite, and abdominal discomfort. Your body gets used to a certain pattern, and changing that pattern can affect how you feel. There's also the question of what happens if you miss a dose entirely. Again, the FDA label has specific guidance about this, but you should discuss it with your prescriber or pharmacist before you're in that situation. They can walk you through exactly what to do based on your circumstances. Let's talk about safety because this is crucial. Tirzepatide has a boxed warning for thyroid C-cell tumors. It's contraindicated if you have a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. The medication also carries warnings for pancreatitis, gallbladder disease, and severe gastrointestinal disease. You should contact your doctor immediately if you experience severe abdominal pain that doesn't go away. This could indicate pancreatitis or gallbladder problems. Reach out if you have persistent nausea or vomiting that prevents you from keeping down fluids. And definitely call if you notice any unusual lumps or swelling in your neck, hoarseness, or trouble swallowing. If you're thinking about changing your injection day, here's what to do. Contact your healthcare provider before making any changes. Explain why you want to adjust your schedule, whether it's for travel, convenience, or another reason. They can review your medical history, consider any other medications you're taking, and give you specific instructions that are safe for you. Your pharmacist is also a great resource. They can review the FDA-approved medication guide with you and answer questions about proper administration. They have access to the complete prescribing information and can help you understand how to use your medication safely. Here's what you should remember. Consistency in your dosing schedule is important for maintaining stable medication levels and optimal effects. Any changes to your schedule should be discussed with your healthcare provider or pharmacist first. Don't use online information, including this video, to make dosing decisions, and always follow the FDA-approved medication guide and your prescriber's specific instructions. For complete FDA-approved information, review the medication guide and prescribing information for Mounjaro or Zepbound. These documents contain detailed instructions about proper use, and your healthcare provider can help you understand how they apply to your situation. The bottom line is this. While there may be some flexibility in your tirzepatide schedule, the details matter, and those details need to come from your healthcare team. They're the ones who can give you safe, personalized guidance based on your complete medical picture. If you found this information helpful, hit that like button and subscribe to Fella Health for more evidence-based health content. And remember, when it comes to your medication schedule, Your healthcare provider is always your best source of guidance.